I want to welcome everyone to the ScHARe Think-a-Thon today. This is a special event for us where we are especially targeting coders and computational specialists, and we're very happy that you are here with us. We're going to give people just a few minutes to log on because in our new Zoom world, we go from one Zoom meeting to another, and sometimes it takes a few minutes to transition. So hold tight for a little bit and we'll get started very shortly. I can watch the numbers increase, but we're going to get started at 3:03. It's 3:03. I want to welcome you all to our Coders Introduction to ScHARe. I'm Deborah Duran, and Luca Calazzoni is there in the picture. We're both from NIMHD, and we do these ScHARe. Your presentation today is going to be on the ScHARe platform, and opportunities for you to actually use your coder skills. Next. ScHARe stands for a Science Collaborative for Health Disparities in Artificial Intelligence Bias Reduction. It is a cloud-based platform that we've developed that focuses on social determinants of health and environment and behavior. In order to build this system, it took many people and many much appreciation to all that helped us. This is the first of its kind in the way that we are navigating. So we welcome you. Next. Today, we're going to give you an overview of what health disparities is. And then we're going to talk a little bit about what AI and bias it is for us on the ScHARe platform, give you an overview of ScHARe, and then talk about training opportunities, which you can apply for, and an opportunity to help us do some research. Next. The first thing that we'd like to do is to just get a poll of kind of what your experience is. And I'm going to turn the mic over to Kevin, who is our contractor who helps us manage these. And he's going to teach you how to use Slido. And we're going to ask you to bring Slido up because there's several little interactions that we are going to ask you to do today on this. So Kevin, I'm going to turn it over to you.
Great, thanks, Dr. Duran. So as Dr. Duran mentioned, we will be using Slido throughout today's webinar to get some feedback from you, the participants. To use Slido, you can either download the Slido app on your phone or simply go to slido.com on your phone or your computer. Alternatively, you can scan the QR code that you should see here on the screen. And lastly, my colleague Mark will also be putting the link for today's Slido right in the chat. So you can just go ahead and click on that link and that will bring you to today's Slido. So from slido.com or the app, you can use code CODER, as you see here on the screen, to join. But if you just click that link that Mark put in the chat, you won't have to actually put in that code. So when we do get time for Slido for some of these polls, the code will be displayed on the screen, so no need to worry about it if you haven't gotten there quite yet. But once we start in on some of these Slido polls, you will be able to join using that QR code that's displayed on the screen. So Dr. Duran, would you like me to launch into our first poll here?
Yes. I just see this message in the chat. Yes, you can transfer over, Kevin. Just so you all know, you don't need to take notes because we will post this on our NIMHD webpage. It takes a week or two because everything has to be 508 compliant. So it's not immediate, but it will be posted. Please go ahead and sign into your Slido because we're going to do our first poll, and this is just to get you started here. We also really appreciate you contributing to these polls and to the information because we actually pay attention to it and use it to set up training and to decide what to do next and how to incorporate your suggestions. So please log into Slido. They put the link into the chat. And by the way, if you have questions or comments, please feel free to use the chat. As we present, we're not going to take a lot of questions during the presentation, but we will try to answer all of your questions by the end of the presentation. So it looks like we have some experience, a little bit of a variety here with Python. Next. Same thing with R. Good, we got some that are proficient and experts. Okay, some with cloud computing. That is a good response because Terra is not something you all would know. Terra is a platform, an interface that is on the ScHARe cloud. ScHARe is a Google platform with a Terra interface. There are many clouds at NIH that use the same interface. So once you learn Terra on ScHARe, you can use Terra on all of us, on Biodata Catalyst, on Anvil, and many other clouds that NIH uses. Next poll. Somehow the disparities research. I'm glad to see that. I was expecting little to none. Next. And same thing with health outcomes research. Next. And we hope that that is going to change by getting involved with ScHARe, that we change from having no or some experience to becoming an expert. So thank you for giving us that, and you have a flavor of what your other participants are doing. Next.
That's the end of this poll. Would you like to go to the interest poll?
Sure. So
here, please feel free to fill out this poll.
oh, I'm glad to see people want to learn about health disparities. Well, it looks like you all came to the right place because these are the types of topics that we're going to be dealing with, especially in our research think-a-thons. So let's go back to the slides. Kevin, please. So one of the things that I want to explain to you, and I love this term, generational career exchange, because when we thought about this platform, we know that many of the younger investigators, students, postdocs, graduate students, bachelor students, you all are the ones who has the data science and the computational skills for big data and Python and R and analytics. In the fields of health disparities, the senior investigators have the content knowledge for research in social determinants of health and health disparity outcomes. And when we thought about how do we put this together, we wanted to make sure that it was a generational career exchange so that the younger generation can teach the older generation of researchers, and the more experienced, I'm older myself, so I'm going to say more experienced researchers can teach the younger statistical coders and Python users about how to use their skills to do health disparities research. So we have this model that it will go up and down, and that we're equal partners in this regardless of our age, because our skill sets will help each other learn. Next. So first I want to explain what health disparities is. So in NIMHD's mission is we have two parts to our name: minority health and health disparities. So minority health is really looking at the characteristics within a population group, any racial ethnic population group. As you can see on the right-hand side of the slides, this is a unique thing the government has to do. We have to follow the OMB directive on how populations are defined. I'm not making an argument that it's right or wrong. I'm just saying that this is what we have to follow. So right now, these are the populations that are defined. In very shortly, we think, they're also going to add MENA, which is a North African and Middle Eastern population group to this as well, but it is not official yet. Next. The other piece that we do is we do health disparities research. So health disparities is really defined as a difference that adversely affects disadvantaged populations. One of the things about a difference when you're talking about health disparities is that it can be intervenable. If a difference is not intervenable, then it's not a health disparity. But when there are intervenable differences that cause harm to a particular group, then we're looking at it as a health disparity. In the health disparity populations are also defined by a congressional mandate. This is also not something that we also have freedom to just do. So this is done by Congress, and has defined the health disparity populations as racial and ethnic groups, people with lower socioeconomic status, underserved rural communities, sexual and gender minorities. That includes all the LGBTQ, and I apologize that I don't get all the letters right, and people with disabilities. And we're really trying to figure out how to identify what causes these inequities, and then what role the mechanisms like social determinants of health play in that, and then how do we intervene. Next. So, of course, the inequities in life, which we often focus on, thanks to COVID, there's more recognition of this, of the social determinants of health. And those are the things that where you work, live, and play. And we think of health disparities based upon these outcomes, that there's a higher incidence or prevalence of a disease, there's premature or existing mortality from a specific health outcome, there's greater global burden of the disease, there's poor health behaviors and clinical outcomes, and there's worse outcomes on related self-reported measures like quality of life. This is very important because prior to this definition, which is in the AJPH journal, health disparities meant a lot of different things, but this quantifies it in what we're actually trying to do when we're doing health disparities research to mitigate one of these outcomes. Next. What we know is that the social determinants of health influence our health behaviors and our health outcomes. So basically, it's where we work, live, and play. We follow the CDC categories so far, especially on the ScHARe platform. We organize our data in this way. Education, healthcare, neighborhood, and built environments. And what we mean by built environments, because that often gets confused, these are like neighborhoods where there's inner cities where there's what we call concrete jungles and there's no green spaces, or there's homes that are around factories and toxins in the air or pollutants in the water. So those are our built environments. And another one is social and community context. So this is your neighborhoods, your neighborhoods where there's rich fruits and vegetables everywhere, or there's food deserts where there's lack of food, and high fast food places and high areas of alcohol stores, but not grocery stores. So those are our community context. And then economic stability. And this is basically job rates and income of a neighborhood. So we try to understand and study these kinds of things in order to understand their impacts on our health behavior and our ability to make healthy choices. Next. So this is what I hope to intrigue you all to help us do. We want to start looking at the data on the ScHARe platform in order to understand how these non-medical factors like the social determinants of health interact with our biology to influence our health. And we really believe that artificial intelligence can help us have that answer because it allows us to look at different patterns of the social determinants of health that we cannot do with using simple data. So this is one intriguing aspect that we hope that you will want to participate and help us do. I'm going to turn the mic now over to my colleague, Dr. Calazzoni, and he's going to take you through the rest of the talk today. I'm happy that you guys are here. I really encourage your further participation, and we, at the end, is going to have a form that we're going to ask you to fill out. So if you have to leave early, please email us or put your name and information in the chat, because we want to reach out to you all, especially because you're the group of people that is going to help us with the analytics part of this research project and really create this career up and down generational training. So I thank you for being here, and I'm going to turn it over to Dr. Calazzoni now.
Thank you, Dr. Duran. Hello, everyone. And it's nice to see some of you again here. So we discussed how
artificial intelligence may have that answer, right? So may help us answer that question. How do these non-medical factors interact with biology to influence health? So does AI play a positive role in biomedical research? Of course, it opens new avenues for discovering insights that were previously challenging to discern. And then it enhances existing techniques by expediting processes, automating analysis, etc. And I'll give you some examples of the positive role that AI is playing in biomedical research. So for example, it helps predict protein folding, and that way it accelerates drug discovery by predicting potential drug candidates. And it also helps identify genetic variations. It can accurately detect anomalies in medical images. Or using natural language processing, it can efficiently extract information from a large volume of scientific literature in a short time. And it can also help analyze patient health data to allow for personalized healthcare interventions. Or again, it can enable the development of personalized treatment plans by considering individual patient characteristics, so genetic makeup, lifestyle, and medical history in what is called personalized medicine. So there are so many positive roles, but there is a but. AI can also be biased. So there are many algorithms out there being used to influence decisions affecting people's health. And the risk with these algorithms is that we may inadvertently replicate and amplify human biases that are already affecting protected groups. And this can lead to outcomes that are systematically less favorable to them. Bias can originate from many sources, including data, or it can manifest at various points in the algorithm development process, as you all know, I'm sure. So in the design phase, or in the training phase, or even in the implementation phase. So testing for these biases in both data sets and models is essential. And we also need better mitigation strategies to ensure that AI does not cause any harm and is ethically applied and really brings benefits to all instead of to some. And I really like this slide here that shows you how biased AI design and deployment practices lead to application injustices. And these application injustices determine real-world patterns of health inequality and discrimination, which in turn are then reflected in the data, which now becomes discriminatory data. And that data is used to train new algorithms, and the cycle continues. So we really need to break that cycle. And I give you just one example of AI bias, one of the most famous ones, I guess, where AI-driven dermatology was leaving fair-skinned patients behind, and I'm sorry, dark-skinned patients behind. And what was happening is that machine learning had been used to develop a tool that was helping physicians distinguish between benign and malignant moles with an accuracy that was similar to dermatologists. But what was happening is that lesions on patients of color were less likely to be diagnosed. So what was happening there is that the algorithms were being trained on an open source repository of skin images from primarily fair-skinned populations, leaving the rest behind. And so the solution there, of course, was to expand this repository to include as many skin types as possible. And there are so many examples of AI bias like that one. So we saw that health disparities, reducing health disparities is important, and reducing bias is also important. So with these two goals in mind, we developed ScHARe. And I'll give you a brief overview on the platform. So I was mentioning it's a research collaboration platform. It's cloud-based, of course. It's focused on the social sciences and the social determinants of health. And it aims to fill 4 critical gaps. So first of all, we want to increase the participation of women and underrepresented populations in data science through training, mentoring, and collaborations. The second goal is to try to induce this paradigm shift, as we call it, in health disparity research, leveraging big data and these AI tools that we make available on the platform. The third goal is to advance, as I was saying before, AI bias mitigation and ethical inquiry. And the fourth goal is to provide a data science cloud computing resource for our community colleges and low resource minority institutions and organizations. So this slide gives you an overview on of the components of ScHARe that ScHARe colocalizes within the cloud. So we have datasets, as I said, including social determinants of health and social science data. We have a data repository that allows us to comply with the required hosting, managing, and sharing of data from NIH-funded research programs. And then ScHARe offers computational capabilities and also secure collaborative workspaces for researchers and students. And also we're going to have tools for collaborative evaluating and mitigating biases. That's going to come in the second phase. In terms of data that the users can access, we host 3 categories of datasets. The first one is the Google Cloud public datasets, which are publicly accessible, federated and de-identified datasets that are hosted by Google, actually, but they are accessible through ScHARe. And this is thanks to the Google Cloud Public Dataset Program. A second category is the ScHARe hosted public datasets. So these are datasets that we host. They are publicly accessible and de-identified. And you can see to the right how that's actually a screenshot from our platform. And you can see how datasets are categorized by content based on the CDC social determinants of health categories that we have seen before, that we saw before. And with the addition of health behaviors and diseases and conditions. And finally, the third category is funded datasets on ScHARe, which is comprised of publicly accessible and controlled access funded program project datasets from NIH and focused on core common data elements. I'll tell you about that in a moment. So the structure is basically focused around some federated public data. We host right now more than 240 datasets hosted by Google and ScHARe. And then we have this data repository, which is CDE focused. So CDE stands for Common Data Element. And I'm sure that most of you know, but a common data element is a standardized way of collecting data. So it's composed of a precisely defined question paired with a set of specific allowable responses. And the systematic use of common data elements to collect data across different sites, studies, or clinical trials allows to ensure consistent data collection and allows to map across different studies and enhance your ability to actually gain precious insights from the data. So here are, on this slide, we gathered our common data elements. You can see the labels here. So there are demographic factors such as age, birthplace, zip code, etc. And then others that are focused on the social determinants of health. So you recognize education, for example, or health insurance, employment status, or health conditions, for example. And you can check them out actually at the link that is displayed on the slide, which is from the NIH CDE repository where our ScHARe CDEs have been published and are now available to the public. This slide shows you kind of an overview of how the platform works and the flow of data through the platform. So you can see in orange our Google and ScHARe hosted data sets, and in green our data from our funded projects and programs. And the repository is in violet. It's focused around common data elements. And on the right, you can see some of the data outputs. So for example, data download, data export, even to other cloud platforms, and data mapping across data sets and platforms based on those CDEs. We actually have 2 main goals in terms of mapping and use of CDEs. So one thing that the platform allows you to do is to map across project and federated data sets using those CDEs. So for example, we can imagine a scenario where we have the American Community Survey data set, and we want to work on a project where pharmacy and health insurance databases are also used. And the use of CDEs allows to map across those data sets. In other scenarios also, the mapping across cloud platforms that share our very same Terra interface at NIH. You can see some of those listed here on this slide. So all of us, Anvil and Biodata Catalyst, for example, they are all based on Terra, which means that learning how to use ScHARe enables you automatically also to know how to use those platforms and to be able to map across cloud platforms. And this opens up so many interesting opportunities in terms of research and possibilities in terms of studies. So these are some screenshots that we wanted to show you from our repository, which is being finalized, it's being built. And you can see how it is CDE focused. And this is actually a screenshot from the tool that allows users to map actually across data sets. And when they upload their data, to standardize their data according to the ScHARe CDE standards. At the same time, as I was mentioning before, ScHARe offers secure workspaces to all users for self or collaborative research. So users are able to create these workspaces, to assign roles to collaborators as reviewers or administrators, and to host their own data and their own code. And in terms of code, we try to make it really easy for our users to reuse modular codes. So we offer what we call copy and paste analytics and modular codes developed for reuse, meaning that we provide instructions on how to access the data, for example, or how to conduct basic analysis and basic operations. And novice users are able to actually reuse our code for their own analysis pretty easily. And we are also adding SAS for those users who may not be as familiar with R or Python. And on the left, on this slide, you can see the instructional notebooks that I was mentioning. So all the Jupyter notebooks, which I'm sure all of you know about. So they are documents that combine textual descriptions with code that you can actually run, and they allow you to run your analysis and collaborate in real time with your collaborators. And we provide a series of instructional notebooks that provide those step-by-step instructions that I was mentioning before, and that make it really easy to, hopefully, to use the platform. And of course, we have the Think-a-Thons. So you're attending one, and they are monthly sessions, about 2 hours in length. This is an exception. Today is going to be 1 hour. They are instructional and interactive. They are designed for both new and experienced users. And the purpose is to have researchers and students at all levels come together and learn how to use the platform, and then conduct health disparities, health outcomes, and bias mitigation research using the tools that are available on ScHARe. And we actually, and the ultimate goal, of course, is to is that this can result in publications from team collaboration, and also to offer our users the possibility of networking with peers, and also of finding mentoring and coaching opportunities. So to facilitate this process, and to also provide some training and upskilling to our users, we organize these Think-a-Thons that, as you can see, provide instructions on how to use the platform. So if you see the titles in blue, you see that most of them are focused on how to use Terra and how to access the data, Google hosted or ScHARe hosted data sets. And other Think-a-Thons are also focusing on providing our users with those basic skills that they need to understand the field and to actually use the tools. So we had one on artificial intelligence and cloud computing. We had a pre-course in Python, and then a series of Think-a-Thons that focused on common data elements, or how to prepare an AI-ready data set, and or how to select the most appropriate computational data science strategy for your data science goals. And then we try also to target our target audience with some dedicated events. So we had one for educators, and we had one for American Indian and Alaska Native researchers. And then you are part now of the one for coders and programmers. And we're going to launch soon these research Think-a-Thons. So these research teams of collaborators that will come together and work around projects that they'll come up with. And the hope is that their efforts will lead to a publication, and that throughout the way, they will learn So senior investigators will actually learn the coding skills from younger members, and younger members will actually learn the research and the health disparity research and the statistical skills, for example, from the senior investigators. So we want this intergenerational career exchange to happen. So this is where we need you. We want you guys to help us explore biomedical research, to develop ethical AI tools and resources, and also to help us foster this paradigm shift that I was mentioning before, and to help us with this mentoring in AI and in health disparity research. And I'll have more on this later. So I want to give you a brief overview of the data that we make available. You can see all the social determinants of health categories listed here. So for education access and quality, for example, we have data on graduation rates, school proficiency, early childhood education programs, etc. For healthcare access and quality, we have data on, for example, use of preventive healthcare or access to health insurance. The neighborhood and built environment category includes data on pollutants, for example, environmental risks, air quality, noise exposure, mass transit use, etc. The social and community context category has data on crime rates, resistance to stress, experiences of racism, discrimination. The economic stability data has data on unemployment, poverty, housing stability, food insecurity and hunger, etc. Health behaviors, of course, data on health-related practices that affect health outcomes. And then diseases and conditions has data on incidence and prevalence of specific diseases and health conditions with a focus on chronic conditions especially, and those affecting health disparity populations. So you can see here some examples of the data sets that we host. So I just mentioned a couple. We have Medicare data or Food Access Research Atlas, or the BRFAS, the Behavioral Risk Factor Surveillance System. And I leave the slides with you, so you'll be able to review this and actually access our platform and check out all the data that we offer. I would like now to see with you how we can transition from data and tools to actual potential projects. And I'd like to give you some examples of how we can use those AI tools and data sets to actually gain insights into the social determinants of health and their impact on health outcomes and health disparities. So we have prepared like 3 examples of potential studies, and there are so many more. And I would actually like you guys to help me formulate more of these research questions in a moment. I'll ask you about that in a moment. And for the first study, for example, I was thinking that we could conduct a geospatial analysis of environmental factors and explore the impact of environmental conditions on health outcomes, especially minority communities. So we would combine environmental data sets, for example, air quality data or pollution levels data, with health records using geospatial analytics and AI models that can reveal spatial patterns. So helping identify areas that have higher health risks in minority populations. And for each scenario, you can see that I've actually collected some of the data sets that we could use and some of the AI tools that could be helpful. So for example, this scenario, it could be helpful to use the EPA data on air quality and this survey, the Health and Nutrition Examination Survey, which includes health data, including respiratory health indicators. And the AI tools that we would leverage would be some geospatial analytics tools. So, for example, geographic information system platforms to map environmental data and health outcomes. And also machine learning for spatial analysis. So algorithms for spatial regression or clustering to identify areas with higher health risks. So that's a first example. A second one could be focusing on education and health disparities analysis. So we could examine the link between educational disparities and health outcomes in minority communities. So to do that, we would merge educational obtainment data with health records and apply AI techniques to try to discern patterns. And we could explore how educational opportunities influence health behaviors, preventive care, and overall well-being. And examples of data sets that we could use here would be the NCES, education attainment data, with data on education attainment, of course, and BERFAS, which is the behavioral risk factor surveillance system, which includes self-reported health data and behaviors. And in terms of AI tools, we could use some predictive modeling and causal inference techniques to accomplish our goals. And finally, a third example is with genomic data. So it could be interesting to explore causal links between chronic stress that is associated with social adversity and health disparities. So we know there are studies out there demonstrating how health is adversely affected by social disadvantage through many mechanisms. So, of course, there is the impact of neighborhoods that influence health through their physical and geographic characteristics. So, water quality, or lead paint exposure, or proximity to health promoting or health suppressing features. And then there is the role of chronic stress associated with social disadvantage or socioeconomic inequality or racial discrimination, which has been proven to influence health. And it does that through a variety of biological pathways, and that you can see actually listed there. So our objective here could be to examine the role of epigenetic modifications, so DNA modifications, as a causal link between chronic stress associated with social adversity and health disparities, and also to study the impact of mitigating factors, meaning those social determinants of health factors, which of them are protective and which of them worsen, actually, these modifications. So these are just examples of possible research that we could conduct together. And I would like at this point to actually ask your opinion. And I would ask Kevin to please open up this poll. I would like to ask you, considering your expertise and experience, what research projects do you believe would be worthwhile to pursue using those data sets that you saw and the AI tools available on our platforms and the Python libraries that you are familiar with? So Kevin, can you please start the poll? Thank you. Eager to read your suggestions. I give you some time. And yeah, thank you, Kevin. So if you can display the results so that you can actually upvote the options that you see listed on screen if you agree that that research project is an interesting possibility. Oh, perfect. I like the suggestion combining genome-wide association studies with multi-omic and exposome data. Exploring how clean environments and geographical data, you have to see if it's a determinant. If you have specific data sets in mind, that would be actually great. Cancer health outcomes. Yeah, occupational health data and environmental exposures. I really like that. I'm actually working on something like that. Nutrition, health equity, and onset of diseases. Perfect. Mediating role of, yeah, risky health factors and role of, okay. Food insecurity outcomes. Economic status and obesity. That's also really relevant. How the social determinants of health and stress affects or results in chronic conditions and comorbidities. Perfect. Thank you so much. I like the suggestions, and you're providing many. You're actually going to review these and bring them up at the first research Think-a-Thon. So this is really helpful. Genetic-based dose exposure responses for typically prescribed and OTC medicines. Looking at different diabetes outcomes for people that have less access to healthcare. Perfect. Oh, interesting. Childhood obesity versus free lunch programs. Participation in cancer screening and cancer mortality. Very interesting. Neurocognitive performance with more comprehensive SDH variables rather than race and education alone. I like that. Perfect. Thank you. Thank you so much. Kevin, can you actually keep the poll open so that, I mean, I'm going to continue with my presentation, but I would invite you guys to continue responding. Thank you.
Yeah, we will keep it open so that you can continue to respond. And just a reminder that, as Luca mentioned, you can upvote all these suggestions that have been submitted in Slido. So we encourage you to take a look through and give an upvote to those that you agree with.
Perfect. Thank you, Kevin. So okay. Perfect. Okay, so we have the data, we have the tools, we have the ideas, and what about training and skills? So I'd like to point you to a series of training resources that NIH provides and that we provide. So the Office of Data Science Strategy actually offers many opportunities. There are links on this slide to the NIH Data Science training resources and to the information on fellowships and job opportunities. And the two links that you see on this page are also really helpful. They have information on grant funding and other training opportunities. And I would also like to leave these slides with you, which have additional links to additional opportunities at NIH. And of course, we have our own resources. So we do make available a lot of resources online. Of course, we have these monthly Think-a-Thons, and all the material is always posted at the webpage that was shared in the chat. So we have the instructional materials even on our workspace, and I show that to you in a moment. We have these YouTube videos and links to relevant online resources on our website. We do offer pilot credits for testing ScHARe for research needs, and we do provide those instructional notebooks that I'm going to show you in a moment if we have time. And I would also like you to know that if you're new to Terra, there are a lot of resources that you can explore. They have a really good section with tutorials, and you can find all the links to the most interesting material here on this slide. And I would now like to give you a short demo of our platform, just to show you what it looks like. I'll try to be brief, but this is our workspace on Terra. And you can see that there are several tabs. This is what a workspace looks like. So there's dashboard, where you as a user can input information on your project, for example. So in our case, we do have information on the ScHARe project, our mission, our vision, the components of the platform, and some information for novice users on how to get started and the kind of notebooks that are available on the platform, and some information on next steps and answers to the most frequently asked questions. And then the other sections are, the most important ones are the data section. I'm going to click on it. And you can see that this is where you can actually access the data. So to the left, you can see several links to tables that list all the available data sets on the platform. So I click on education access and quality just to show you one of them. And you can see that from this table, you can access all the data sets, and there is information on each data set in terms of size or the category or the year the data refers to, and actual links to the files, to the data dictionary, information on the file format, and links to the original source homepage. And of course, feel free to explore. You're going to be able to register for ScHARe. I'm going to provide instructions for you to do that. And feel free to register. It's free, and you can access all our resources and explore the datasets and maybe come up with new ideas besides the ones that you already shared with us and let us know. So I now go to the analysis section. And this is where all those instructional notebooks that I mentioned before are accessible. So you can see from the titles that some of them explain how to, for example, configure the cloud environment, the cloud computing environment, and both in R and Python, because Jupyter Notebooks on Terra support R and Python. And you can see that we also provided instructions on how to access, plot, and save data, for example, from the different categories of datasets that we host. So everything should be pretty straightforward. And then we have some notebooks that also explain how to prepare AR datasets and demonstrate some visualization tools that you can build using the platform. And I'm just going to open a preview of one of the notebooks just to show you what it looks like. So every notebook has clear instructions on what you can expect from the notebook, what you can learn, and then actual cells where you can simply run the code by pressing a button, and everything is already prepared for you, and you can actually reuse the code for your own purpose if you feel so inclined. Perfect. And there are other sections, of course, which will be really interesting, but we probably don't have time. We don't. So if you have any questions on this, I'm gonna come back to this. I'll be happy to do that. Perfect. Then I'll go back to my presentation, because the last thing I want to do today is to ask you to work together. So as I mentioned, we're going to launch those research Think-a-Thon soon, in February or most likely March. And we're going to have those researchers form teams, collaboration teams, and work together around projects and develop, brainstorm research ideas, and work together using our tools on the platform and our resources to work on those projects, and eventually, that eventually will lead to a publication. So as I was mentioning, it's really important that those teams are multidisciplinary, and also that all kind of skills are represented. So both the research skills, but also the coding and the programming skills, which are essential, of course, given that the analysis are going to use Python and R. And I would invite you to take an active role in these ScHARe research Think-a-Thons. And if you're interested in doing that, I would invite you to fill in that form. You can scan the QR code, or I will also ask Kevin if you can please paste the link in the chat. And you're going to be led to a form that you can actually fill out, and it's going to be easy. It's 3 or 4 questions. And when you do that, when we launch the research Think-a-Thons, we are going to contact you ahead of time and with further instructions. And I would really appreciate it if you would do this. And I look forward to seeing you, a lot of you, at those research Think-a-Thons when we launch them. So I'm going to leave this on screen for some time, and I'd like to take any questions you might have in the meantime. We have a few minutes, so I'm happy to do that. Kevin, actually, if you have any questions that you have seen in the chat.
Absolutely. We've definitely seen a lot of questions in the chat. Thanks to everyone for putting them in. There were some questions about, let's just start. For accessing the data, is it necessary to file a license, for example, NIST to SP 800-60? So are there any issues there in terms of filing for a license to have access to the data?
Okay, so to access the data, it's actually pretty simple right now, because we only host publicly available data. So it's publicly accessible. All you have to do is register for ScHARe. And I'm glad that you asked this question, because I'm going to provide you guys with instructions to do that. So that's another link that you can use to register for ScHARe. And I'm actually very happy to help you guys. If you have any difficulty registering, you feel free to contact me. You can use the email address that you see on this slide. But the registration procedure is really simple. You fill out a form, and then we get back to you with instructions on how to access ScHARe. And once you have access to our workspace, accessing the data is as simple as what I showed you earlier. So you actually click on the data tab, and all the data is readily accessible there. So there are no complications tied to controlled access data for now. We'll get to that in the future, but for now, it's all publicly available data. So I hope that answered your question.
There was one other question. Are these data nationally representative?
It is, yes. If I have time, I'll take some more questions, and then if I have time, I'll go back to the data and actually show you the data sets that we have. But yes, data is nationally representative, yes.
Great. There were some other questions that I believe you actually just answered, but I just want to make sure. So there was a question just about, what are the security and privacy considerations that we need to use the data? What did the process look like when publishing, and permissions? And are there any data provenance policies or tools? I believe that's what you just answered, but wanted to make sure.
Yes, actually, yes. So there are no particular complications at the moment, since it's all publicly available data. So it's going to come in the future, but for now, it's just publicly available data. And Kevin, what was the last question, please?
It was very similar and related to the first two. So it was all on the idea that the data is publicly available. So there's a lot of questions coming into the chat right now. So we certainly appreciate those. There's one. Do you have a data set of BLS?
Oh, I'm sorry, Kevin. I'm seeing. Oh yeah, yes, we do. Yes, we do actually. Yes, you can check that out on the platform. And I'm also seeing questions like, are beginner programmers welcome to projects? Yes, of course. This is meant to provide you guys with the opportunity of learning new skills. So of course, programmers and researchers at all career levels and of all disciplines are welcome to join the research think-a-thons. And yes, of course, it can work for state level projects too, of course. And I want to scroll up to see if you have any technical question. I see some technical questions around notebooks or how to access data. Feel free to reach out to me using the email address that you see on screen. And there are, yes, environmental exposure, lifestyle, and occupation data sets on the platform. Yes, the answer is yes. Let me see if I can answer a few more. I think we are at time. So I would, okay.
And I did, yeah, Luca, I did just put in the chat that ScHARe email address for anyone whose questions we were not able to get to today. Again, a lot of questions coming in, so thank you for your interest. But please feel free, if you didn't feel like we got to your question today, go ahead and send it to ScHARe@mail.nih.gov. We'll put it in the chat a few more times, but it's on screen as well.
And I would like to thank everyone for joining us today, and to invite everyone to register for ScHARe and to register to sign up for our research think-a-thons.